Everyone. My name is Michelle Leftwich. As Diane stated, I am an RN and I am the administrator with McKenney Home Care. I'm excited to talk to you today about aging in place and empowering seniors to live comfortably and safely at home. Just to give you a little background on myself, I've been a nurse for probably close to 15 years. I have done everything from bedside nursing to home health to now private duty, assisted living, memory care, and skilled nursing. So I don't think there's anything in nursing wise with seniors that I have not done at this point in life. So I look forward to talking to you, and hopefully we can have some questions and answers as we go through this. So aging in place is for older adults who prefer to age in place, making safety modifications to their home or downsizing to a residence that requires less maintenance and features fewer mobility barriers. That can be a very crucial decision, excuse me. Aging in place successfully requires careful planning and oftentimes a caregiver, social support system, and consideration of future health problems. I know we don't often think of it. Heart disease, diabetes, and cognitive decline are some of those top ones. So some of the introduction. The definition of aging in place is the ability to live independently, that's huge, comfortably, and safely, another big issue, in one's own home or community as you age. It allows seniors to have control over their living arrangements and maintain their quality of life, while also having support from family, friends, or the community. Some of the benefits of aging in place are the emotional benefits, such as familiarity and comfort. You've been in your home, you've made your memories. None of us want to leave. So with aging in place, with the right things in place to help you age in place and stay home, you're able to keep that. Your independence, that is huge. I know none of us as we age think about that we can't wait to move into an assisted living or memory care or possibly even a skilled nursing. So that is where that introduction to aging in place and what that might look like. The stress of moving, it's huge no matter what age, but especially as we get older, we get a little more stuck in our ways and moving can be a little more difficult. The social benefits of the community tie. Those of us that have lived in places 10, 15, 20 years or longer, you have ties to the community and don't necessarily want to leave and maybe move to another state where your children are. Maintain your social network. It's just as important as when you were younger to maintain your friends, your social group, things that you enjoy doing. The financial benefits. It is a cost, it can be cost effective to stay home depending on what you've got and what's happening, whether you need to move to assisted living or a skilled nursing. And then the customized care that can come from aging in place and having the right services around you. The role of private duty. So private duty home care refers to personalized non-medical or medical care provided to individuals in their homes by trained caregivers or licensed professionals such as nurses. This type of care is tailored to meet your specific need and include a wide range of services. The services are highly flexible and be provided on an hourly basis, part-time, or 24/7, depending on the client's needs. It's especially beneficial for individuals who wish to age in place, recover from surgery, or manage their chronic conditions. What that can look like is assistance with activities of daily living, like bathing, dressing, grooming, toileting. Companionship, just someone to provide that social interaction, conversation, and that emotional support. Household assistance, light housekeeping, meal prep, laundry, your grocery shopping, errands. Transportation, escorting to your appointments, and as I said, running some errands, and then medical care. So something as your skilled nurse coming to fill your med box, to wound care, to IVs, or just monitoring your condition, especially if you just come out of the hospital with possibly CHF or COPD, or you have a new diagnosis of diabetes and what that looks like in that education. I'm going to kind of dive in a little deeper. I know we talked about it briefly, but the comfort and familiarity. To be able to stay independent and self-sufficient is empowering. Moving to a new environment often requires adjusting to new routines, which can be disorienting and lead to feelings of helplessness or loss of control. Personalized care is the context of aging in place with private duty offers a highly individualized approach that enhances safety, comfort, independence, and overall life satisfaction. You will often hear us talk about safety. It is a big issue. Independence. Aging in place with private duty can empower you to allow you to stay in home and stay as independent for as long as possible. That is always the goal, to stay as independent safely as long as possible, and to keep that sense of dignity. Engagement. Private duty can really help with the personalized and flexible support that encourages the social interaction, the physical activity, and the cognitive stimulation and emotional well-being that is needed. It really is meant to help seniors remain active, connected, and fulfilled. And I see we already have a question, so I'm going to go ahead. Oh, Diane, I think she's asking
Yes,
you.
they were asking about the recording. Okay. So just a reminder that yes, this will be available on our YouTube channel. I'll send the link through the chat.
Thank you. There we go. Considerations for aging in place, home safety modifications. And as you can see with the picture, the bathroom, you're going to install grab bars. Those can go in your shower. Also in your bathroom, it might be an over the toilet riser that helps you to hold on and get off your commode easier and safely. The hallway, installing handrails. Obviously, all homes hopefully have smoke detectors. Your kitchen, I know you don't stop to think about it, but an automatic shutoff feature is a huge benefit, especially for your stoves. Living room, removing rugs. They are very much a safety hazard. They tend to flare up on the sides, and that can be a trip and fall hazard. Outside, removing trip hazards like rocks and roots. Those are some just examples of safety measures that you would do at home. Financial planning. There is long-term care insurance. There's also veterans assistance, but most of that is done through private pay with private duty. I wanted to share an amazing success story with you all. A daughter who had been a registered nurse with 30 years of experience in home care and hospice care, that had seen and worked with many home health agencies, was never fully able to let go of the immense need to supervise her mother-in-law's care. The compassion, professionalism, and speed of response is nothing short of amazing. Within a matter of 3 days, my 101-year-old mother-in-law had an administrative evaluation, clinical evaluation, as well as an assessment of my husband's and my needs as her primary caregivers. What once seemed like a nightmare for a future has now been transformed into a peaceful, calm, and sustainable life for both my husband, myself, and my mother-in-law. This is a woman that at 101 is still swimming, still very much active, but needed that support. Also, the family needed the support to be able to leave her alone and start to have their own life and do things. And this is where private duty can come in. We were able to go out, meet her, find out what she liked, what she wanted to do, and create an individualized plan for her that met her needs, as well as gave the son and daughter-in-law comfort, knowing that their mother would be taken care of. So I want to talk to you about the little differences between private duty providers. There is private duty agencies and there are private duty registries, and they are very different. The private duty agency is a home health agency that hires their own employees, and the employees are scheduled to care for clients under the management and supervision of agency staff. The agency is responsible for workers' compensation and all taxes. Agencies carry general liability insurance and a dishonesty bond. Agencies assure that the employee has the right to work in the U.S., is free of communicable diseases, and has the requisite training to perform all services, and has a background check that is free of criminal offenses. The agency is responsible for all risk associated with work performed by the employee. Those are huge things. I know that you may not think about it when you start looking, but when we start to look at the difference between an agency and a registry, you will see it's a huge difference. Nursing registries, on the other hand, arrange for services of home care workers on an independent contractor basis. The workers are directed to care for clients. They are not employed, nor are they supervised by the company. The registry is not responsible for workers' compensation or other employee taxes. Clients have exposure to risk when they employ individuals from a nurse registry. It is unclear exactly who the employer is, if in fact the client may be responsible for all taxes and the liability of the caregiver. So those are huge differences when you compare them. It very much is, you can see the significance of having the agency compared to the registry. How to choose a private duty provider. First and foremost, assessing your loved one's needs. More often than not, we don't stop and think that we want to invite a stranger into our home to help care for us. But when you get to the point that that is the need, then you really need to talk to your loved one. And what does that look like? What is their personality, your loved ones? Are they private? Do they like to talk? Do they like to educate? A lot of the clients that I personally have been with, I've enjoyed sitting and listening to their stories of their childhood or learning how to crochet. Back before I became an RN, I was a CNA, and going out, meeting new clients and working with them, learning new skills and just learning the history, things that you don't learn in history books. You're going to want to research and gather recommendations. So obviously Google is huge in our day and age, looking at Google reviews, talking to your friends, asking the company for recommendations, good and bad. You want to hear it all. You want to verify the licensing and the accreditation. In particular, our company, McKenney Home Care, is through AHCA, the Agency for Healthcare Administration, as well as ACHC. Evaluating the caregiver qualifications and training. So asking that company, what does your caregiver training look like? What does your annual education? What do they do to do something different, to be above and beyond? Consider the agency communication and support. So asking, who is your point of contact? What is their response time? What happens if something goes wrong? Who do I talk to? A great example is with us, we are 24/7. You can call at any time. You will get someone who will answer the phone, as well as if you need a nurse, we have a nurse on call 24/7. Holidays, anytime, day, night. Another big thing you want to think about is caregiver continuity. It's very important that your loved one creates a bond and a relationship with that caregiver. So depending on your needs and the needs of your client, excuse me, you're going to look and want to know, what would it look like? It's very different when you just have a caregiver coming in 4 hours a day, a couple times a week, compared to 24/7. That changes the dynamic of how many caregivers are coming in the home. So you're going to want to know, can you have that same caregiver? How often, and what would that look like? As well as if there is an issue with the caregiver, how quickly can they get that caregiver out and get someone else in to help meet those needs? Meeting the staff. We like to go out and make sure that we meet the family, meet the client. Not only do our aides, our client care coordinators, as well as RNs, and at times myself, if need be, or if I get the opportunity to get out and meet everyone. Ultimately, like with everything, you need to trust your instincts. You know what's best for your loved one. So there are some future changes happening of aging in place. Smart home technology, increased integration. A lot of homes are becoming smart homes, and how they're able to turn on devices, monitor your health, detect falls, even do reminders for medication. Voice activated assistants like your Amazon Echo, those are huge. It allows families to communicate as well as people to call out. Many of us experience telehealth due to COVID. So obviously we've got virtual healthcare visits that are able to happen. Wearable devices that track vital signs. There are scales that you get on if you have a diagnosis of CHF that you would get on daily to monitor, that immediately gets sent to your doctor. A big thing that is coming out is AI and data analytics, what that looks like as far as artificial intelligence and how that can help us. Genomic medicine is also changing. We are learning so much about genomes and how to not necessarily stop aging, but possibly slowly slow it down. Virtual communities, I think, again, with COVID, that really opened up that platform for a lot of us. And the intergenerational living. This is huge in Florida, where we are starting to see more and more homes built so that you have that intergenerational, just as we did back in the 20s and 30s. The aging in place infrastructure. I know that a lot of things are being built to accommodate the wider doorways, different bathroom setup. Transportation solutions are changing. Government is really looking at how to make seniors better, have better support in aging, including incentives for home modifications, increasing funding for home-based care, and expanding the Medicare coverage for in-home services. Insurances are changing as to what they will allow. Your Aetna, United Healthcare, different organizations like that are also working to help pay for your private duty. Smaller scale, but there is help for that. The caregiver support, the training that is involved is becoming more and more. Respite care, those are available whether it's through private duty or assisted livings. Even some memory cares offer respite care to families. I would like to thank you all. I know this has been kind of a short and brief one, but this is my information. If you have any questions, I'm more than happy to answer them.
Thanks so much, Michelle. A reminder for the participants in the Q&A bubble at the bottom of your Zoom screen, please type in any questions that you may have for Michelle. Michelle, I appreciate that you brought up a concern that I hear a lot from our clients and in support groups is that caregiver continuity, because sometimes people with Parkinson's may have some cognitive decline, some dementia and so forth, and it does take a toll on them and the family if there is a constant turnover of the staff. So appreciate you bringing that up, and the fact that the staff can come out and meet with the families ahead of time, super important, before they decide to go ahead with the care. I know a question that I get asked, and I'm wondering if you could speak a little bit more to, is about the cost involved with the home care. You mentioned a couple of insurance companies that are starting to make that coverage available, but if you could talk a little bit more about the home care expenses and maybe the long-term care benefits and how those get activated.
Yes, so it depends on your policy for long-term care. Some don't have a stay time that you have to wait. Some are 30 days that you have to have the care before they will then initiate your claim and get started paying you back. But yes, we are starting to see where your insurance provider, especially coming out of the hospital, if you don't want to go to a skilled nursing for rehab, you want to come home, they are allowing sometimes a week or two that they will pay for private duty to be home with you to help make sure that you're safe and you have everything that's needed. And the pricing can vary. It depends on the different shifts. So for us, for example, we do everything from 1 hour to 24/7. What we do charge is a $125 nursing fee. That is a one-time fee. It is for the assessment, as well as long as you are a client with us, you have access to our nurses. We come out every 90 days and do a reassessment. So every 90 days, the nurse is coming out, putting eyes on you, checking vitals, checking the house again. But if you go in the hospital or something happens and you come home, the nurse comes out free of charge. The entire time you are with us, it is completely free of charge outside of that initial visit. And again, that just gives you access to the nurse 24/7, as long as you're the client. Billing, so our 1 hour is $45 an hour, 2 to 3 hours is $40 an hour, and anything 4 hours and up is $35 an hour. We are adjustable. We do try to work with families and figure out what is the best fit for the family and for that client.
Great, thank you. And then to expand a little bit on the assessment, sometimes I know our clients will call, they're considering maybe some companion care, maybe some assistance with activities of daily living, and but they aren't really sure what to ask because they don't really know what their needs are. So how does that assessment and evaluation kind of help guide to what, particular needs you can help with? And also in regards to that, you mentioned assessing the person's vitals and so forth, but also checking out the house. Are there ever, do you make recommendations for home accommodations, grab bars, those type of things?
Yes, absolutely. So ours is twofold. Ours is a little unique. So our client care coordinator will come out and meet with you, meet with the family, whoever is inquiring. Excuse me. and they will gather information. They kind of have their own checklist of what they need to gather, and they bring it back to the office, and myself as a nurse and then our other nurses will go over it. It's assigned to a nurse who will come out. And again, if the family's there or just the client, meet with them and talk with them. So it's not just a head to toe assessment where we're putting on our clinical hat and going through everything, although from the moment we enter, we are looking at everything and assessing. But we're also talking to that client. What is it you enjoyed doing? What is it you did in your past? What are you hoping to get from this? How can we help enrich your life? Sometimes you have people that are just homebound and haven't been out. They're scared to drive, or they're afraid to go out because they're afraid of walking, or any other issue that might occur. And that's where we're able to come in, really get to know them. And what's great about it is between the client care coordinator and the nurse going out, we really get to know the client. And then we're able to come back to our scheduler and talk about, okay, I think this caregiver will be a great fit. They share some common interest, or they come from the same area. They come from Pennsylvania. Let's connect them and see how it works. So that's part of how we come out and assess things. As far as home modifications, absolutely. We do a home safety assessment when we come out. And so we are looking, we walk the house, we look at the stairs, we look at your shower, we look at your commode, we look at the bedroom, we look at rugs. Truly, from the moment we walk in the door until we leave, we are kind of assessing how you maneuver in the house, what is safe, what is not, and then give suggestions as to what we think might be beneficial and best.
Perfect. Thank you so much. Let's go ahead. I'm going to open one more time. Any question and answer bubble questions you want to add in there, go ahead and type them through now. I think sometimes, Michelle, what I hear from our clients is the fact that they're hesitant to initiate that service, to make that first call. So I think that the information that you shared with us today will definitely give some comfort to people in understanding the process. So I appreciate that. So,
Yes, thank you.
right. Well, we don't have any other questions coming through right now, so we can go ahead and wrap up this session today. Again, this will be available through our website. And Michelle's contact information is there. If you have additional questions that you don't want to ask in the group and would like to talk with her directly, please feel free to give her a call about any aging in place or home care services. So thank you, Michelle, for being here today. And thank you to all the participants for joining us. Have a great afternoon.
Thank you.